Beth Lawley. I'm a student physical therapist assistant at Jeff State, and my presentation today is on Paget's disease. Paget's disease is a progressive metabolic bone disease. It is a disorder of the osteoclast, which are bone resorbing cells. It is the second most common metabolic bone disease behind osteoporosis. So how it works is there is an initial resorbing stage where osteoclasts proliferate unrestrained. This stage is followed by an osteoblastic sclerotic stage where the normal bone is irregularly thickened, rough, and pitted. The new bone is enlarged, but it is in a weakened state. This leads to decreased stability and further complications. On the left-hand side of the screen, there's a comparison of normal bone versus Pagetic bone. A person with Paget's disease may have deformities of their lower extremities, such as bowing out of the legs, as in this case. And then the picture of the right is Paget's disease of the spine and pelvis, and it is currently in the osteoclastic stage where the bone has not been replaced yet. There are various ways to diagnose Paget's disease. It is actually most commonly diagnosed on accident when screening for other disorders such as osteoporosis. There are some screening tests that can be performed which measures alkaline phosphate blood levels that can be used to test for at-risk individuals. Alkaline phosphatase is an enzyme produced by bone cells, and it is overproduced in persons with Paget's disease. Bone scans can also be used only if the disease is active and marked by rapid bone turnover. Bone scans can provide information about the extent of the condition. A bone biopsy may be performed for a medical differential diagnosis to rule out other conditions. Paget's disease is a common disease in the aging adult, rarely presenting before the age of 35 years old. There is an increased risk for this disease after the age of 50, but the prevalence of the disease in general, it is declining. It mostly affects the weight-bearing structures of the body, such as the spine, pelvis, and the legs. You can see in this picture, this is a comparison of normal bone versus Pagetic bone. And the Pagetic bone is very pitted, there's less bone density, and you can see how it would not be stable. Medical prognosis of Paget's disease depends upon the specific bones that are affected and how much the disease has progressed. The course of disease varies from stable and asymptomatic to rapid progression of signs and symptoms. The outlook is generally good, particularly if treatment is given before major changes have occurred. In about 1% of people affected, osteogenic sarcoma is accompanied with the disease. The prognosis is poor for persons with Paget's sarcoma and is unrelated to the site or stage of presentation. So the goal of treatment is to normalize bone health for a prolonged period. Pharmacologic agents can decrease bone turnover through the inhibition of osteoclastic activity to improve bone density and reduce fracture incidence. Nonsteroidal anti-inflammatory drugs can be used to control the pain that occurs with this disease. If the disease course has progressed far enough and has caused musculoskeletal deformities, surgery may be indicated. Surgical interventions may include fracture repairs, occipital craniectomy, tibial osteotomy, and in some cases, joint replacements. You can see in the lower left-hand corner, this person has very enlarged legs and bad deformities, and this person cannot walk. And the guy at the top has Paget's disease of the skull. It creates an enlarging skull, and this person may have to have an occipital craniectomy to remove part of the skull. And then on the right-hand side is a fracture of the femur, and this is a very common fracture because they have an increased risk for falls and therefore an increased risk for fractures because they have less bone density. Paget's disease causes multiple impairments, functional limitations, and disabilities, and it can affect multiple systems, including the musculoskeletal, nervous, and cardiovascular systems. Musculoskeletal impairments include deformities of the skeleton, bone pain, fractures, muscle weakness, and muscle stiffness. Nervous system impairments include nerve compression, decrease in mental functioning, and sensory neural hearing deficits. Cardiovascular impairments include an increased cardiac output and failure of the heart in worst cases. Musculoskeletal deformities such as thoracic kyphosis, enlargement of bone, coxa vara, coxa valga, these can cause various functional limitations. There is an increased risk for falls due to decreased balance and proprioception. Abnormal gait patterns can also develop from deformities of the trunk and lower extremities. Bone pain, decreased hearing, and decreased endurance can result in the inability to perform normal activities of daily living and decreased function in general. Also, nerve compression can produce a variety of symptoms that can affect a person's ability to function normally. An individual with Paget's disease may not be able to participate in their normal societal roles due to worsening of symptoms and decreased function. In order to address these impairments and functional limitations, physical therapy is an important aspect in the treatment of Paget's disease. Therapeutic exercise is essential for focusing on increasing strength, flexibility, endurance, balance, and coordination. Strengthening and stretching muscles will help to correct muscular imbalances. Weight-bearing exercises will also help to improve bone density, which can decrease the risk for fractures. Endurance exercises will help to improve cardiovascular function and also help the individual to resume normal activities of daily living. Balance and coordination exercises will help to reduce the risk of falls, therefore decreasing the risk of fractures. Another intervention that could be used in physical therapy treatment is the use of electrical stimulation for pain management. Paget's disease produces bone and muscle pain, which can be relieved through the use of electrical stimulation. Transcutaneous electrical nerve stimulation, or TENS, uses the gait control theory to modulate pain. The gait control theory is a theory of pain control that states that pain is modulated at the spinal cord level by inhibitory effects of non-noxious afferent input. TENS will produce a comfortable sensation without muscle contraction to gait pain. Though Paget's disease and osteoporosis are two different diseases, they overlap in contraindications and precautions that therapists should take when working with these patients. There is an increased risk for fractures in persons with Paget's disease. Therefore, precautions should be taken with exercises and the use of physical agents. Certain exercises should be avoided, such as jogging, running, and jumping, because these are high impact and may cause fractures. If the spine is involved, forward bending and twisting exercises should be avoided as well. Therapists should be knowledgeable about the various protocols after an orthopedic surgery to prevent further injury. If physical therapists or PTAs are working with an elderly person, they should know the signs and symptoms of Paget's disease. Screening is an important part of working in physical therapy. Therapy personnel are very hands-on and can catch certain diseases that may have not been diagnosed previously by a physician. So patients may present with headaches, hearing loss, tinnitus, vertigo, incontinence, diplopia, or swallowing difficulties. In conclusion, the presence of Paget's disease is declining in the general population and has a relatively good prognosis if diagnosed early. Education is a good form of prevention, both in the general public and within the physical therapy profession. Paget's disease is most often familial, and a good way to prevent prolonged complications is to be screened for Paget's disease if a close relative has this disease. Therapists should also be aware of the signs and symptoms in order to promote prevention and treatment of the disease. Physical therapy cannot stop the disease process, it can only help relieve symptoms. Therefore, a physician needs to determine the other courses of treatment to help prevent long-term effects of the disease. And that is all for my presentation on Paget's disease. If you have any questions, feel free to comment and ask.